This video is for PCOD. I got a demand that I made a polycystic ovarian disease video in Hindi. So there is a demand that I should make it in English also, because there are some people who can understand English. So I am Dr. Dipankar Banerji from Jabalpur, and I am a gynecologist with special interest in reproductive medicine and fetal medicine, that is in genetics also. So this topic of polycystic ovarian disease is very complex, and there are a lot of girls and young married couple, young married ladies, they suffer from abnormal periods, irregular periods, with lot of hair growth on their face and chest, and with acne. These things are very common nowadays, and I don't know why, but might be because of overweight, or in our day to day what we are eating nowadays, more refined fats and all. So I just want to make clear why this thing happens and what is polycystic ovarian disease. If it happens, then how can you come out of it? Can you come out of it? If you are attained your puberty or in adolescence, you might be having irregular periods 2 to 3 months, and then period happens, it goes for 15 days, 20 days, and when you get married, there are difficulties in getting pregnant also. These things continue. Can you treat before marriage so that the girl can have child whenever she requires or wants after marriage? These things are very common to me, and the girls, they are coming to me with this type of problems, and I really understand their agony, that they change doctors continuously, they are not relieved, and they have questioned why I am suffering from, why I am not having regular period every month, what is with me, why I am different. So I want to say how it happens and how we can treat it, rather I should say change the course of the disease. So how this, I just want to make you understand what is polycystic ovary. See, this is uterus, and there are two ovaries, and with every month there is, and one thing which should be very clear, that whenever the girl takes birth, there are 100,000 eggs in her ovaries, and when she attains puberty and release egg, and gradually for releasing one egg, there is a race of eggs to get selected, and this race is near about 1000 eggs. One gets selected, 999 they die. That means you are losing your this sack or this wallet gradually every month. Now what happens in natural way? These 1000 eggs, they go in unison and they run for the race. So one follicle, they that wins over other, and this follicle is a shell or the covering of the egg. Then there is a collection of some liquid inside, it grows, and in that ruptures and the egg comes out, it goes into fallopian tube. If lady wants a pregnancy, then the sperm travels from here, fertilization takes place here, and now there is a movement in this fallopian tube, and with this movement, this fertilized egg or blastocyst comes into the uterus and gets implanted, thus the natural pregnancy takes place. This is the way a natural pregnancy takes place in a woman who wants a baby. If she doesn't want a baby or unmarried, then this egg goes over there and it waits for 14 days, for 1 to 2 days, and this lining is also waiting for the getting the fertilized egg. But when she doesn't get anything, then this lining is released, and this is called menses. This happens every month, and most of the time it is 21 to 35 days, this interval. This is normal. So what happens with the polycystic ovary patient, that menses is not regular. So menses is dependent on release of egg. So why they don't release the eggs? I tell you the reason. There are some changes in the ovary or in the body when there is a race of 1,000 eggs or many eggs, everybody wants to win. So they run. But because there is no place to come out, they get entangled or they get fixed at certain level. So they become multiple eggs in a almost same size. They arrange in like this fashion. So what are these? These are fluid filled follicle. Within that there are eggs. Because they are poly means number is more. Because they are containing some fluid, so they are cystic. Any sac which fits fluid inside is called cyst. And it is in ovary, so it is called polycystic ovary. Now there is a disease. Why there is disease, I'll let you know. Now what happens? When this thing happens, nobody wins. If nobody wins, then this lining of the uterus, it waits and waits and waits, if somebody will come here. When nobody comes, then it releases its line and this menses continues for sometimes 10 to 15 days. After 2 to 3 months of waiting, 10 to 15 days. This is the normal phenomena happening in polycystic ovarian disease. Now what is happening here? Because there is no release of egg, so the getting follicle ruptured is not possible. Along with that, when this happens, there if I make it little bit bigger, then what happens? This follicle becomes like this. There are multiple follicles and there are eggs. The lining of the follicle, lining of the cyst gets activated and it releases male hormone. That is called testosterone. Now, if there are more male hormone, then this testosterone or male hormone will go to the body circulation. Whenever this male hormone goes into the circulation of a girl and it goes dominant over her female hormone, that is estrogen, so she will have some effect of male hormone which we have, that is having beard, having mustache, growing of the hair in abnormal places which usually females don't have. Now, if this thing happens, then there will be problem in, you can say, in a face and all. This is called hyperandrogenism. That means you are having androgenic effect. Most of the time these girls, they are overweight. Whenever there is overweight, that is body mass index is more, that means fat is more. Whenever there is more fat, any female hormone which becomes or formed in the ovary, it goes into fat, it becomes an abnormal female hormone. This female hormone again prevents this selection also. Whenever there is more fat, these girls, they have a problem of, when we take glucose, suppose we take glucose, so like we take food, sweet, whatever it is, this glucose goes into the cell to get utilized. So there will be energy. To make energy, we take carbohydrate. But this glucose, to enter into the cell, there is a gate which should pass. It should open and it should go through. This gate is, there is a gatekeeper. That gatekeeper is called insulin. There is a problem in the gate also when you get overweight or there is some genetic problems. If this gate is resistant for glucose to enter, you need more insulin to open. So insulin becomes high. Whenever this insulin becomes high, this insulin acts on this gate as well as it acts on the ovary also. That is on external outer part of the follicle, which is called theca. This theca is known for making male hormone. That means there are multiple effects. If you get overweight, abnormal female hormone, it will not able to get it selected. If you are overweight, there will be more insulin resistance. Sometimes in normal weight also insulin resistance might be there. So there is some problem in the insulin sensitivity or resistance. Whenever this insulin resistance is there, this insulin goes high to maintain this sugar to come into the any cell to make energy so that we can move. So this insulin goes up and this makes the more androgen. Now this lady is having a follicle or ovary which is rich in a fluid which is rich in testosterone, and this testosterone is releasing in the body also. Any egg under the environment of testosterone will never grow. The quality of egg goes down. So the fertility, if she wants to reproduce, the fertility goes down. Then what is the remedy? How can you come out of it? If you are overweight, change your pattern of food and reduce the calorie. Most important. Second, burn more calorie. That means exercise. This will help in to reduce weight. But mind it, weight reduction is the most difficult thing. So when you do exercise, if the weight is not going down, don't get disheartened, because it will not go down easily. But what will happen with your exercise? This gate will become sensitive to insulin. Whenever there is a more sensitivity to insulin, the less insulin will be required to open the gate to glucose to enter. Whenever this insulin goes down, the activity of the insulin on the male hormone producing substance will be reduced. So there will be less male hormone. If there is less male hormone, the beauty problem of the female will go down. Plus, there might be good selection of egg. Second, if you do exercise, if you do weight reduction, with this, the insulin sensitivity goes up and the fat goes down also. With this fat goes down, the quality of the estrogen also improves. Now, what I do with these patients, can we change this environment? There are methods, like I give some drug which is called clomiphene citrate or letrozole. It acts over it, and there are various mechanisms so that there might be one selection of one egg. But sometimes they don't work. The patient who comes to me, usually they have taken this. My way of working is, until unless you reduce this testosterone from this ovary, there will not be any sharp change. What I do, I aspirate all follicles from ovary. I aspirate this liquid transvaginally under ultrasound guide. Suddenly there will be loss of testosterone from the ovary. Now with that we get eggs also. Now if this lady is trying for issue since long, this egg can be fertilized with her husband also. We can make embryo. Now we can freeze it also. Whenever she gets normal or weight reduced, then we can do a frozen embryo transfer, or we can do a fresh embryo transfer. But quality of seed is little bit less, so there might be no pregnancy. But with this treatment, because I have reduced the total male hormone content of the ovary, there might be natural pregnancy later on. So you must have noticed that even the IVF failure in polycystic ovary, there might be natural pregnancy later on. This happens. This is the way I treat. But this is the treatment for the mostly for the married ladies. Even though if we go for this, there might be some methods we can destroy or little bit injure this and suck this follicles from up above with laser or with electric energy. This is called laparoscopic ovarian drilling. This might help to release one egg and reduce the testosterone level, but it takes longer time. So there are methods which you can come out from this, because polycystic ovarian disease is quasi genetic disease and it is environmental also, and it depends on your day to day activity, your food pattern, how you exercise, how you maintain your weight. Lot of external things also happen, but there is a predilection, genetic predilection, predisposition for having polycystic ovarian disease in families. So my way of working is that it reduce the testosterone as early as possible. Now if girl is unmarried, wants to get treated, then reduce the testosterone by methods of exercise, by reducing the weight, or give some drug which changes the environment of the testosterone into more female hormone by giving lot of pills and all. But these are stopgap arrangement. The main thing is you have to change your way of life. You have to change the type of food you are having. Go to the more natural way of foods. We can say a Mediterranean food like things you can have. But if you want to reduce the weight and do an exercise, take a professional help. And most important thing is, don't get disheartened that you are not able to reduce weight. Even exercise without reduction of weight helps in improving your insulin sensitivity and reduces lot of things. Otherwise, what will happen later on, even though it might have a pregnancy may take place, but because of insulin resistance, if this goes on, the blood glucose level goes up. This is called condition of diabetes. So they are more prone for diabetes also. Sometimes these girls, when they have more insulin resistance, they will have a dark line on their neck, on their shoulder, on their axillary area. So this is called acanthosis nigricans. So these are the various stages of complication or gravity of the disease. So if these things happen, take care of yourself. You can fight with PCOD. PCOD is not, you can win over it, and you can have your normal periods and normal baby also in a natural way also. If it is not possible, don't get treatment for too long. Have an aggressive approach, which I do normally in my day-to-day practice. Thank you very much for patient listening, and I request you, if you like my videos, then follow me on Instagram, or I am on Spotify also. You can search in Spotify podcast Ideal Fertility, or go to my YouTube channel and subscribe it. Thank you very much for patient listening.